Here we'll look at the bones belonging to the pelvic girdle. We saw that the pectoral girdle contained the shoulder joint, which was very mobile. And part of that mobility was due to the fact that there were very few number of bony attachments that the scapula made to the axial skeleton. The pelvic girdle, on the other hand, is much more robust than the pectoral girdle, since it must be able to support body weight. As a result, the pelvic girdle is largely immovable. Even the movement at the hip joint is much more restricted than we saw with the movement at the shoulder joint. The two hip bones of the pelvic girdle are very firmly attached to the other bones of the pelvic girdle, as we'll see in just a moment. So, as we've discussed, the pelvic girdle attaches the lower limbs to the axial skeleton. In humans, since we are two-legged animals, the lower limbs must support body weight, while our upper limbs generally do not support body weight. So therefore, the pelvic girdle is much more stable, much more robust, and much more immovable than the pectoral girdle is, simply for the function of carrying body weight. The pelvic girdle also supports and cradles the organs within the pelvic cavity, due to its bowl-like shape. So the pelvic girdle is formed from the sacrum, which is part of the vertebral column, and the paired coxal bones, which are also called the hip bones. Each hip bone unites with the other hip bone in its anterior side by way of a joint called the pubic symphysis, and the hip bones unite posteriorly with the sacrum. So looking at a hip or a coxal bone from the lateral side, we see that each of the large and irregularly shaped coxal bones consists of three regions, which here are highlighted in green. We have first the ilium, which forms the superior aspect of the coxal bone, the ischium, which forms the inferior and posterior aspect, shown in the lower left in purple here, and the pubis, which forms the inferior and anterior aspect, which is shown in the lower right in red here. These regions were initially three separate bones in the fetal skeleton. In adults, they are all fused together into one, and therefore the hip bone functions as a single piece. At the point where the three regions are fused together is a deep socket that's called the acetabulum. And the acetabulum is where the head of the femur connects to the hip bone and forms the hip joint. We also see a large opening called the obturator foramen at the junction between the ischium and the pubis. The obturator foramen is typically filled with a layer of connective tissue that serve as a support for skeletal muscles that will attach to its internal and external surfaces. Specifically on the ilium, we will examine the iliac crest and the greater sciatic notch. The iliac crest is the margin of bone that we can feel or palpate through the skin when we put our hands on our hips. The greater sciatic notch is a deep indentation in the posterior side of the ilium, and it functions as a route for the very large nerve, called the sciatic nerve, to run from the spinal cord through the back of the thigh. So continuing with the ischium, we see that it contains three important structures. The first is the ischial spine, which serves as a point of attachment for a ligament that will join the sacrum to the ischium. Just underneath that ischial spine is a small indentation called the lesser sciatic notch, which provides a pathway for nerves and blood vessels to reach the anal and genital regions of the body. And finally, the inferior surface of the ischium contains a roughened and thickened area called the ischial tuberosity. This is the site of attachment for the hamstrings muscles, which are the muscles that are located on the posterior thigh. And it also serves as an attachment point for a large ligament that connects the right and left hip bones together. Additionally, when we are seated, the ischial tuberosity supports our body weight. Finally, we have the pubis, which forms the anterior and inferior aspect of the hip bone. When we are standing in anatomical position, the pubis is nearly horizontal, and we see that the urinary bladder actually rests upon its superior surface. The anterior aspect of the pubis is thickened, and this region is called the pubic crest. The right and left pubic regions are joined at the midline of the body by the pubic symphysis, which is a fibrocartilage joint. The joint does allow for a little bit of movement to occur between the right and the left coxal bones, But more importantly, it also permits expansion of the birth canal through the center of the pelvis, or the pelvic girdle, for females during childbirth. So which brings us to our next topic, which is going to highlight the differences between the shape of the male pelvic girdle compared to the female pelvic girdle. And of course, we're going to see important anatomical differences between the male pelvic girdle and female pelvic girdle, because the female pelvic girdle has to be built for childbearing. So first we'll start with a structure called the pelvic inlet, and this is an opening through the channel that exists in the middle of the pelvic girdle. In females, the opening is oval shaped, and in addition, the sacrum is tilted back, which helps to create a wider birth canal. So this pelvic inlet serves as part of the birth canal. In males, the sacrum tilts forward, and the pelvic inlet is much more narrow, as is the channel that actually exists through the center of the pelvis. Its shape is approximately the shape of an anatomical heart. The bones in the pelvic girdle of females tend to be much lighter and thinner than they are in the male pelvic girdle. And recall that this is the case for the remainder of the female skeleton, as females tend to have much thinner bones and less bone mass overall than males do. So in females, the pelvic bones tend to be flared out, which functions to create a wider pelvis or pelvic girdle than in males. Males have a pelvic girdle that's much more vertically oriented. This difference in width is also reflected in the angle below the pubic bones, which is an angle called the subpubic angle. In females, it is greater than 90 degrees, although here our OpenStax textbook says that this angle is greater than 80 degrees. And in males, the much more narrow and vertically oriented pelvis creates a narrow subpubic angle, which is typically much less than 90 degrees. Again, here our textbook states that the subpubic angle is usually less than 70 degrees in males.